Okay, good morning, everyone. Good morning, good afternoon, good evening. It's been a wonderful week here at ASTMH. I'm Karen Goraleski, the CEO of ASTMH, and we are in our last day of our annual meeting. But right now, I'm here fully, completely, because I wouldn't miss an opportunity to celebrate 15th anniversary of the President's Malaria Initiative. From any metric, PMI is a success story. And I think about what Bill Foege said the other day at the 40th anniversary of the smallpox eradication. He said the best decisions are made on the best science, the best results are made on the best management. And this describes PMI to a T. From any metric, PMI is a success story. It's had bipartisan support in Congress and in the White House. It has and continues to save lives. It's a smart economic investment that's given a strong return on investment. It's partnerships around the world. And through those partnerships, it's a critically important diplomatic tool in a way that only the global health community, research all the way through implementation, can do. So I'm thrilled that we have the entire history of leadership with PMI with us today, Admiral Ziemer and Dr. Ken Staley. And also, I'm really pleased that we've got Professor Wirth, who is a longtime ASTMH member and past president of ASTMH. She's going to facilitate the conversation today. She's got an extensive CV, and I'm going to do her absolutely no justice to that impressive CV by introducing her simply as one of the world's leading malariologists. So with that, Dyann.
Hello, and welcome to all of you, and thank you, Karen, for that introduction. And indeed, it is a pleasure to be here to celebrate PMI's anniversary, again, a success story. Today, we're going to hear from the two people who have led the President's Malaria Initiative since its inception. We will also hear from some of PMI's partner countries about the results that PMI has helped them achieve. Before we start, let me just say a few words about PMI to provide you with some context for what you're going to hear from our speakers. When President George W. Bush launched the U.S. President's Malaria Initiative on June 30th, 2005, his goal was to save lives, give children the gift of a healthy childhood, and break the cycle of disease and poverty in places where malaria hits hardest. He said, and I quote, "We know that large-scale action can defeat this disease in whole regions, and the world must take action," end quote. Since then, PMI has become one of the U.S. government's greatest global health and development successes, as Karen just pointed out. It is led by the U.S. Agency of International Development and co-implemented with the Centers for Disease Control and Prevention. PMI was originally envisioned as a 5-year initiative in 15 malaria endemic countries in Africa. Thanks to very strong bipartisan support, and I think thanks to the success and the leadership, first of Admiral Ziemer and now Ken Staley, U.S. Congress has really supported this, and the budget has increased since then. It is now expanded to 24 African countries and 3 programs in the Greater Mekong subregion in Southeast Asia. PMI delivers cost-effective, life-saving interventions alongside catalytic operational assistance to equip and empower partner countries to be able to end malaria. The progress in reducing malaria disease burden and death has been significant. PMI reports a 27% decline in malaria case rates and a 60% decline in malaria death rates in PMI partner countries. New challenges have emerged, including drug and insecticide resistance. There are competing priorities, as we know, but the gains of the past 15 years show us what is possible. As we look to the future, many countries are on the path to malaria elimination, and the global community is seriously again talking about total eradication. With that said, let's move to our fireside chat with Ken and Tim, and it's my great pleasure to introduce the previous and current U.S. Global Malaria Coordinators, Rear Admiral Tim Ziemer and Dr. Ken Staley. Let me just say a few words about each of them. Rear Admiral Ziemer was appointed as the first ever U.S. Global Malaria Coordinator in June 2006 and led PMI until 2017. Prior to his retirement earlier this year, Admiral Ziemer had a long career in public service, beginning with 30 years in the U.S. Navy as a pilot. Admiral Ziemer also served as Senior Director for Global Health Security and Biodefense at the National Security Council and as Acting Assistant Administrator for the Bureau of Democracy, Conflict, and Humanitarian Assistance at USAID. So welcome to Dr. Ziemer. Ken Staley is a physician by training, and he is the current U.S. Global Malaria Coordinator. He was appointed in April 2018 to lead PMI. Recently, he's also served as Executive Director of USAID's COVID-19 Task Force. Prior to PMI, Dr. Staley was a consultant at McKinsey & Company, where he worked on responses to Ebola and MERS. Dr. Staley also served as Acting Deputy Assistant Secretary for Counterproliferation in the State Department's Bureau of International Security and Nonproliferation, and as the Director of Biodefense Policy at the White House Homeland Security Council Biodefense Directorate. So I'm now going to turn this over to Ken and Tim for their conversation, and I'll be back at the end of their conversation to introduce words from PMI partner countries and close the session. I look forward to this discussion. Ken and Tim, it's your turn.
Dyann, thanks so much, and thanks to everyone for being here. Tim, it's great to see you again, and I'm looking forward to this, both reflecting on what's happened so far in PMI's 15 years, and I'm looking forward to the next 15. So let me kick it off. You were appointed as the first ever U.S. Global Malaria Coordinator in 2006. What was that time like?
Yeah, Ken, good morning, and it's good to see you as well. Thank you for the invitation to allow me to come back for a moment in time and celebrate really a success story for the U.S. government and the global health community. But let me just pause a second. Karen, thank you for your leadership at ASTMH, and also Dyann for your role in leadership at Harvard. Both of you have been with PMI since the beginning, and it reflects exactly one of the reasons PMI has been successful. So thank you. Ken, let me set the stage for a second. If you recall, in 2005, the malaria burden in Africa was crippling. I recall stories, and then I later saw that when visiting a hospital, there were 2 or 3 kids in each bed. The mantra then, the drumbeat was, a child is dying of malaria every 30 seconds. Everybody knew it, and it was happening. When President Bush looked at his strategic focuses for his administration, Africa as a continent was front and center. And he was focusing in on education as well as business development. When he understood that HIV was undermining both of those principled important objectives, he launched PEPFAR, and the rest is history. But when he learned and heard that malaria was killing more people than HIV, he determined to do something about it. And Karen and Dyann have given a little history. About in 2005, at the G5, he announced that the United States government was creating an initiative, and he committed $1.2 billion and asked the other countries to step up to the plate. And so that was the environment that PMI was launched.
So people talk about PMI as a game changer. Why do you think PMI was a game changer?
Yeah, again, we've already heard from Karen and Dyann, but I think it's really important to emphasize. First of all, we couldn't get any higher leadership focus than the President of the United States and the First Lady. We had strong bipartisan support. We had funding committed and then delivered. Those 3 points of a recipe for U.S. government programs indicate green light and success. Shortly after the announcement, we had a White House Malaria summit, and that was a game changer as well, Ken, because what it demonstrated was an all-out invitation to the private sector, to the universities, to all the countries, and the multilateral partners to come together for the single focus of improving on this whole malaria burden. The decision to house and host PMI at USAID was a significant organizational decision. While USAID was the agency lead, it was well supported by the State Department, DOD, HHS, and CDC. And I attribute much of the success for PMI as a simple organizational structure that everybody embraced. As you know, all of our interagency partners look at things differently, but I must compliment all of the partners for understanding that organization matters and protocol matters, and that really was one of the most successful elements of moving forward. And then the other one, of course, was our focus. While this was driven by the White House and the Hill, our real focus was at the country level itself. And when you narrow it down to a mother and a child in a community in the middle of nowhere, that is the appropriate focus. And PMI picked that up. We inverted the paradigm. We put the people and the community at the top of the paradigm, and then built our strategy, our sub-objectives, and our entire strategic plan on that.
Yeah, I think I have been a recipient of a fantastic organization with a lot of the same key success factors intact. I mean, we have incredible bipartisan support. We have sustained funding now over 15 years with increases consistently across 3 administrations. And we have great partnerships across the US government, especially with USAID and CDC. But just as you mentioned, most importantly, I think we are country focused. So we fit our plans into NMCP plans, not the other way around. You know, one of the things that we talk about a lot in programs like this is metrics. When you started PMI's initial metric was to reduce malaria deaths by 50%. How did you decide on that goal?
Yeah, Ken, that's really a good question because measuring progress really enables additional funding, additional support. I must tell you, the 50% target to reduce morbidity and mortality was not mine. It was not President Bush's. At that time, the Millennium Development Goals, supported by WHO and driven by the UN and supported by the African leadership, both on the medical and the political side, really drove towards that 50% target. And so it was very simple for us to align with an existing target and goal to reduce morbidity and mortality. And so based on that, and piggybacking on excellent work of previous researchers and scientists of effective interventions, and you know them well, and they're characteristic of what PMI embraced. 3 prevention interventions, spraying insecticides, insecticide-treated bed nets, intermittent preventive therapy, an ambitious testing program through RDTs, and then the lifesaver, the use of artemisinin-based combination therapies, packaging a clear, focused number of interventions, targeting the most vulnerable group, women of childbearing age, and kids under 5 really allowed us to focus. And as we did that, we were at USAID, we were able to leverage the existing programs in the countries we were working to build and benefit upon the existing maternal child health programs, as well as health systems and the logistics and the commodities. So it really was an opportunity to piggyback on others' goals and existing programs.
And I think one of the things that impressed me coming in was the relentless focus that you'd been able to help PMI keep over the first 11 years or so. It's really incredible, and I hope that we've been able to maintain it. And I think you're exactly right. That ability to measure is what eventually garners more support and has paved the way for what PMI is doing today. So let me shift a little bit and ask you about challenges that you faced. What were some of the challenges that you faced early on, and how did you address them?
Yeah, Ken, the challenges that I have are different ones than you've been able to embrace and move forward on. But as we got started, just shaping the proper team. Anytime you have a mission, organizationally, you have to say, whoa, what's my team? Once you understand the mission and the target and the goal, you have to shape the team. And we did that at 3 levels, very importantly. In Washington, we had an excellent interagency leadership team that bought into the program at HHS, CDC, State Department, DOD, and the Peace Corps. So we shaped an excellent supportive team at the headquarters level. But more importantly, we had a very robust, active, technical level team consisting of CDC, NIH, and USAID practitioners and proven programmatic and scientists that actually vetted the objectives and sub-objectives. And then, more importantly, we put together a team in the field, a combination of a CDC and a USAID practitioner, and then put together a team in the country that reflected their needs, their size, and the budget that we were able to focus. So we really had a 3-tier team that we put together. So as both of us have acknowledged, if you focus on the team and on the country, we were able to put together a team that reflected those requirements. And then to make sure that we weren't running solo. It was so important, and this is the benefit of being at USAID. We were able to leverage existing health programs. So PMI, while it had its own source of funding and leadership and teams, we were able to actually do cross-sectional training and capacity building. And so really, that was the easy part, was to put that together and to articulate it and then hand it off to people like you.
Well, I think the way you've handled challenges has really been a blueprint for the way we handle a lot of ours. And I think it's always critical to get great people. And I think it's a testament to PMI over time that we've attracted so many, and we continue to attract so many because of the mission and, again, because of the management structure you were able to put together.
Yeah, Ken, I've been doing most of the talking. Let's flip the page here. As PMI coordinator today, what are some of the current challenges facing PMI in the larger global malaria context, not only in Africa, but in Asia?
Thanks, Tim. I think there are a number. I'll highlight 3. The first is insecticide resistance. Insecticide resistance threatens one of our most important interventions, insecticide-treated nets. So first thing we've tried to do is increase our monitoring, really, to understand the scope of the problem, so we know precisely where new tools are needed the most. And then over the last few years, we've been able to introduce new nets. So we've intensified our efforts to combat insecticide resistance by putting new nets with multiple insecticides into the field. Second thing that really is a big challenge for us over time is drug resistance. So we're starting to see evidence of resistance to artemisinin in Africa. It's still a first-line treatment. It's still highly effective, But where we're seeing resistance, it bears watching. And so I think one of the things that we're focused on, again, is monitoring. We have a great network now, the PARMA network, that we've created in collaboration with our country partners. And so we're always increasing the monitoring of the efficacy of our drugs. We're also emphasizing best practices like test and treat, and ensuring that folks take the entire course of their medicines. The other thing I think that's hopeful about that challenge is that we have a lot of new treatments in the pipeline, and that's due, again, to the incredibly strong malaria community and to Medicines for Malaria venture in particular. I think the other challenge I'll mention here is the reason that we're virtual today, and that's COVID-19, which has really impacted everyone's life.
Yeah, Ken, that is the elephant in the room. And as you were designated the USAID COVID leader for a very, very challenging time, if you could just give us a couple insights or thoughts on how COVID has impacted the sustainment of malaria programs pre-COVID, through COVID, but more importantly, as we look to the future.
Sure. Well, I think the good news is that as COVID began to spread, there were some really dire projections about backsliding that might occur against all the progress we've made over the last 15 years. The good news is that hasn't happened yet. So to support our partner countries, I think we've first thought about technical guidance. Almost immediately after COVID-19 was declared a pandemic, we created technical guidance for programs and collaborated on creating global guidance for all malaria programs around the world. And I'd be remiss if I didn't acknowledge the leadership of the deputy coordinator, Rick Steketee, who really led that effort. And I think that guidance has made a tremendous impact on our ability to respond. Second thing is supply chain. We've emphasized from the beginning of the pandemic, working across countries to make sure that where we need malaria commodities, we're getting them, and prioritizing orders to send supplies where they're most needed. We've also been working with governments quite a bit, asking that they make commodity manufacturers essential so that we can continue to get medicines and other medical materials to the people who need them. And then finally, you mentioned the way in which we've been able to collaborate across USAID to leverage other global health platforms. Well, I think now we're able to use the platforms that PMI has been able to help create to help protect healthcare workers and to respond to COVID in the last few months. I think in terms of the way in which we've responded, or the way that I would measure our success, there's a few things I'd highlight. One of my favorite pictures of you, Tim, is actually at a bed net distribution. There's a massive crowd, and you're handing bed nets out to folks who've come to gather. As everybody knows, that's not something we can do during COVID. We can't have a mass gathering. And so in the last 6 months, all 13 of our PMI bed net campaigns have gone off, not in the traditional way, but by going door to door. So we've adapted our programming and made sure it continues. Similarly, that the insecticide, the IRS, insecticide residual spraying, it's a tremendous logistical operation. And in the time of pandemic, it's really difficult. I'm incredibly proud to say that 11 of 12 campaigns that we planned have been executed. And for our seasonal malaria chemoprophylaxis, we've been able to make sure that all 9 countries that were planning SMC have been able to continue it. So, those are, I think, incredible successes in this time. And that's reduced, I think, the burden on the healthcare system because there's less malaria, but also because, just importantly, there's less fever coming into the system. So people don't have to worry about being overwhelmed in the same way.
Yeah, Ken, I was going to ask you the impact of some of those adjustments, but you gave us some really good examples of some tangible real world adjustments. What that does is it really reflects on the leadership at PMI and along with our interagency colleagues, but specifically the people in the field, to make the adjustments to keep the program going and to the extent possible, not only sustain, but keep the programs from eroding. So well done to you and the entire PMI staff on the COVID response. Looking forward, we've been talking about the past and the current, but looking forward, what are some of the challenges that you not only face today, but anticipate for the future?
Well, I think when it comes to COVID, one of the biggest issues we have is costs. So costs have increased between 15 and 25% during the pandemic. And ultimately, that may impact everyone's ability to continue the level of care, but we're adapting so far. I think another challenge we have right now is that, well, just as in the United States, people are nervous about seeking care. So there's reduced care seeking sometimes with fever. So that's something we have to combat. As is the case in the United States, healthcare worker infections in our partner countries have meant that in some cases we've had to do temporary pauses in operations. But despite all that, I think for the most part, it's been a real success story for everyone. And you're right to say it starts with the folks in the field. So we continue to monitor it and think about the ways we may need to adjust based on what we see. Is that sort of what you were thinking about?
Yeah, it was exactly. That is really an excellent response to how you're adjusting to COVID. Now, put COVID aside if it's possible, because one day COVID will be behind us, okay? But it has really shifted the landscape underneath our platform and framework and how we think and work. Are there any other specific opportunities you think that we need to identify and get our arms around just to keep the momentum, not only of PMI, but the greater malaria effort underway?
Absolutely. I think it starts with exactly where you started. We focus on scaling proven interventions. And second, this is the new opportunity, I think, we can actually use data as one of our key interventions. So data can drive progress and better management over time. We can collect more data, we can integrate it better, we can analyze it, and then we can help make decisions. Ultimately, I think we have an opportunity as a community, not only to see data as a core intervention, but to create a new norm that says data is viewed as a common good that can help all of us get better results. I think another opportunity we have is to encourage the greater use of community health workers. So, we've seen how effective community healthcare workers can be in many countries. And I think if we can advocate for and folks will support putting more community health workers out there, we'll see even better results. Finally, we've been able to really double down on the partnerships that we have with our in-country partners at NMCPs, but also with some of our global partners, the Gates Foundation and the Global Fund, where we're sharing data and trying to coordinate more at the global level to make it easier on our in-country partners to work with us. I think that's another area of opportunity.
Yeah, thanks, Ken. Really pleased to see the emphasis on the community health workers. That was the basic and the framework by which we actually, I think, catalyzed and accelerated our community response. So I'm really grateful for your focus on that, particularly as you align it with metrics and data and looking at how to continue to leverage that. I see we're very, very close to the end of our time, but in the last 3 or 4 minutes, I'd like to wander off the grid a bit and talk about moving from a drop in morbidity and mortality to eradication. I can remember when I started PMI, the elimination eradication word was verboten. We were not allowed to talk about that. And it was clearly at the Bill and Melinda Gates Forum in October 2007 that Melinda Gates uttered this vision of elimination and eradication. There was a groan and a moan followed by a hush in that very technical scientific audience. And as the quiet subsided, I'll never forget Margaret Chan, who was DG of WHO, stood up. And I'm not sure if she got on her chair or not, but she said, "If you dare follow me into eradication." And there was an applause by the people who had just groaned. But I know you're a commissioner on the Lancet Commission for Malaria Eradication. And I'd really, and you know, I know their vision and their goal is to eradicate malaria within a generation. In the couple minutes we have remaining, could you just put some of your personal thoughts and reflections on the requirements for that?
Well, you know, I think what was amazing to me coming in to PMI was seeing actually in real time the change that was occurring in people's mindsets still, right? So there was that ambitious declaration, but over time, I think it's become more of a consensus. And, you know, when we think about what we've recommended in the Lancet Commission, I think it starts with improving management at the international level, at the national level, and the subnational level. And that starts with training, but it also relies on better data, understanding what's happening and then being able to improve things. So using data more effectively. Improving our effectiveness too by introducing new technologies. So there's a number of new technologies on the horizon, from attractive toxic sugar baits to genetically modified mosquitoes that could really be game changers for us in the next few years. And then finally, increasing resources. Ultimately, there's been great and sustained funding from the United States and others, and countries have increased their funding over time. But we really want to, there's a real focus now on domestic resource mobilization in endemic countries. One of the things I'm pleased by is that PMI has been able to be at the forefront of many of those efforts, working with NMCPs to improve management, helping to collect data, and as you started the conversation, making sure that we're scaling proven scientifically based interventions.
Yeah, Ken, that's really encouraging. And, you know, I recall when I went over to give President Bush my first update on PMI, he waved me off. He said, "Z, I got it. I read your PowerPoint. Just go save lives." And that was his direction to me. When we look at where we are today with the work of PMI and the efforts of our partners in the interagency, the vision and the achievement of eradication not only will save lives, but it'll improve health security. It'll have a major impact on poverty reduction. And when that goal is achieved, and as we build health systems to deal with other invading viruses or bacteria or parasites, we can redirect the resources going into malaria into those other programs. So it's an exciting time. I'm grateful to have been part of it. I'm so grateful that you've been at the helm over the last couple of years. PMI is better off. So I turn it over to you, and then we can go back to Dyann because I know we have a tight timeline here.
Well, I couldn't have said it better myself in terms of the impact that this program and eradication of malaria eventually has and will have. And I'll just say thanks to you. From the moment I was appointed, you have been an incredible friend and person to turn to for advice and counsel. So thank you. Dyann, why don't we turn it back to you?
Great, thanks to both of you. We just have, I think you've given us sort of your final thoughts. If there's anything else you want to add, we have a couple of minutes, but then we're going to turn to some messages from, I think one of the important achievements of the PMI program has been creating partnerships with national malaria control programs. And we're going to hear from a few of those and how that partnership has really impacted how they're able to deal with malaria in their own countries. So anything that either of you want to add? I'd say optimistic, but clearly progress in the last few years has slowed a bit. And I think it's important as we look to the future, as the Lancet Commission did and as WHO's report on eradication did, that we do need to think about what we're doing and how we can improve it. And I think, Ken, you've pointed to data. You've been a strong supporter of more data and more data analysis. I would say, with my hat on as an educator, I think the other thing that we really need to emphasize going forward is that capacity building and training, particularly in the data area. It's a new and emerging area for many of the national malaria control programs to use, you know, sort of modern approaches to data management. So I think a real opportunity there. And I commend the partnership, not only at the country level, but PMI at the global level, including collaboration with WHO, with the Global Fund, with the Gates Foundation, with other national programs, DFID and others, you know, sort of country bilateral programs, to really make the approach to malaria a uniform one, and one where there's coordination. Each player has its own role, but it really is important that everybody be working on the same game plan. And I think both of you have really emphasized that during your time in your leadership roles. So with that, thanks to both of you. We're going to now PMI has invited leaders from some of the programs to speak about their partnership with PMI and to talk about the achievements and the opportunities going forward. These videos are pre-recorded, and we thank the participants for taking the time to have their thoughts presented. We're first going to hear from one of PMI's first countries, Uganda, with remarks from Dr. Jimmy Opigo. He's the Assistant Commissioner for the National Malaria Control Division, and I understand that the video will play, so I hope I'm correct.
As we commemorate the 15th anniversary of the US President's Malaria Initiative, we also celebrate the great achievements delivered, especially in Uganda. Within this time, we have seen malaria prevalence dropping from initially 42% in 2009 to a single digit 9.2% in 2019. We celebrate the partnership and the support we have received from the PMI, which has enabled us to set effective systems for surveillance, for case management, malaria in pregnancy, vector control, especially IRS, entomological surveillance, and strong surveillance in the country. We really need to celebrate this partnership, because even within COVID, we have been able to leverage on the adaptive style of PMI to keep malaria down despite what has been postulated. Currently, we have worked on a great future, a strong cutting-edge strategic plan with PMI. Having done that, we are now focusing on how to build capacities to bring this to reality. But as we do that, also we have agreed on how not to allow COVID to disrupt us, but to see what we can leverage and what adaptations we can do. We cannot celebrate this without appreciating the great support we have received from the American people, millions of dollars invested in our countries, bringing this impact, the headquarters staff, together with the Bill and Melinda Gates Foundation, to support our work. Thank you very much. We wish you a happy celebration and many years of collaboration.
Thank you, Dr. Opigo. Next, we're going to hear from Dr. Buchan Thavrin, Deputy Director of the National Control for Parasitology, Entomology, and Malaria Control in Cambodia. In 2011, PMI expanded to the greater Mekong because of the major problem of drug resistance, and recognizing that dealing with drug resistance in the greater Mekong might serve to reduce the spread of drug resistance to other malaria endemic areas. So next we're going to go to the video.
As we celebrate the 15th anniversary of the U.S. President Malaria Initiative, I would like to take this opportunity to thank PMI and the people of the United States for their generous partnership with Cambodia, our Mekong neighbor, in the fight against malaria. Since partnering with the U.S. President Malaria Initiative in 2011, Cambodia has decreased Plasmodium falciparum malaria case by 76% and zero deaths since 2018. Also, has made the great headway toward achieving our case management, ensuring 100% parasitological diagnosis of all suspect cases and provision of effective treatment of all confirmed cases, particularly at the community through village malaria worker and mobile malaria worker. 2 years ago, Bosak province had the highest case of any province in Cambodia. Now, the province has significant reduced case, zero Plasmodium falciparum. One key of Cambodian malaria success in the introduction of the 137 approach to malaria surveillance and response by the PMI support Ziemer program. This approach to have all cases of malaria report within 1 day, case investigation conducting within 3 days, and in-depth investigation and response conduct within 7 days, support hundreds of village malaria worker, mobile malaria worker, and health staff have been trained to implement this high-case effective approach, and this model has been seen scaled up to province through support from the Global Fund and other partners. Since 2016, PMI has supported us in our effort to address the malaria connect to the forest and forest-free area in our western province. One known as epicenter of the drug resistance, the province has successfully interrupted local transmission in the last 2 years. A key part of our success has been PMI support efficacy monitoring of anti-malaria drugs that allow us to update treatment policy and respond appropriately to the drug resistance. With the support from PMI, I am proud to say that Cambodia is on track to eliminate Plasmodium falciparum by 2023 and Plasmodium vivax by 2025 in mid-2. We look forward to introducing effective implementation of Plasmodium vivax eradication. Together, we will stamp out the remaining ember of the malaria and extinguish within Cambodia one of the oldest diseases known to man. Thank you to PMI for being an important collaborator with Cambodia and in the greater Mekong region. It is my honor to congratulate you on 15 years of fighting malaria and saving lives.
Great. Well, thank you very much, Dr. Thavrin, and congratulations to you on the great progress in Cambodia and more broadly in the greater Mekong. That's one of the success stories, and hopefully your goals, which are quite ambitious, will be met. So 3 years ago, PMI added the latest 5 partner countries to help protect an additional 90 million people from malaria. One of those countries is the Cameroon, and we now welcome remarks from Dr. Dorothy Fosa Achu, the National Malaria Control Program's Permanent Secretary. Dr. Achu.
On behalf of the Cameroon people, I would like to extend our warmest congratulations to the United States President's Malaria Initiative, PMI, on its 15th anniversary. The partnership between PMI and the government of Cameroon started in 2018 when we identified the two most affected regions, which were the far north and the north regions. And PMI, with their support, we were able to deploy a package of interventions, malaria control interventions to these two regions. This included vector control tools like the bed nets, where PMI supported since 2019 the campaign to distribute over 2.6 million bed nets to the entire population of these two regions. And they've been distributing bed nets as well to pregnant women of these two regions. PMI acquired over 2 million rapid diagnostic tests and over 500,000 treatments to support case management in the population of these two regions. PMI also supported in strengthening chemoprevention in the population of children under 5 years through 3 seasonal malaria chemoprevention campaigns, which have been conducted successfully since 2018, during which we cover about 1.7 million children every year with effective treatments. Within this framework also, and as a baseline study, PMI has supported us to conduct a malaria behavioral survey, which helped us to identify the behaviors of the households in which affect the uptake of malaria interventions. We would also like to appreciate PMI's contribution in building the capacity of the staff, both at central, regional, and district levels, and in the support in strengthening the health system, as well as in data management. So in this domain, with PMI support, we intend to continue work on the data systems, data integration, visualization, and analysis, and ensure that we have quality data and that the data is used for decision making. But we also intend to continue strengthening the supply management system to ensure continuous availability of malaria commodities at health facility level. We extend a sincere appreciation to PMI and to the American people for all they are doing to help malaria control in Cameroon.
Thank you very much, Dr. Achu. And with that, I think we have a few minutes. We've been very efficient. So I've asked Tim and Ken to come back and give us any final thoughts, and then we'll close the event. So again, I think we all heard from the country representatives the importance of the collaboration and the progress that has been made, even in the country that was one of the countries that was added most recently. So I think we can see that the lessons and systems set up in PMI now can be expanded to other countries and begin to work effectively almost immediately. So with that, Ken, maybe I'll turn to you first and then to Tim.
Sure. Thanks, Dyann. I think 15 years ago, no one would have imagined that we would be talking about eradication in PMI countries, but here we are. I think it is absolutely remarkable to think about the progress we've made to date. Now, we know we have a number of challenges, but we have great cause for optimism. And I think one of the most interesting anecdotes I heard serving on the Lancet Commission really was the change in the number of treatments that we have in the pipeline, the number of new technologies that are coming to us in the next few years. It's cause for tremendous optimism. And while the road won't be easy, I think we truly do have the opportunity to eradicate malaria within our lifetimes. And that, I think, is a credit to everyone, from the healthcare workers at the level of the community to the national malaria control programs, to folks at PMI, to folks at other global organizations. It's been a global effort, and I think we all deserve to be proud of where we've come from, but also to be very optimistic about where we're going.
Great.
Thanks,
Thank
Dyann,
you.
again for hosting and for all your support over the last 15 years.
Yeah, great. Thanks, Ken. Tim?
Yeah, Dyann, thanks again for moderating and Karen for hosting. And I just want to echo what Ken said in his wrap up. A couple points. It is the progress to date has been a collaborative one. We've heard that word over and over. Private sector, education, our advocates, UN Foundation, Malaria No More. None of this could have happened without that type of collaboration with the countries themselves. But as we celebrate a milestone today, we need to look into the horizon and realize we're not done yet. Dr. Mohammed Jadawi's words still haunt me today when he said we eliminated malaria 3 times in Zanzibar before. I'll never forget going to Ethiopia with Dr. Bernard Nolan, and he took me to a graveyard of trucks and vehicles of a previous WHO and global malaria eradication program. Something happened then that undermined the momentum. So I think the lesson and the challenge for us today is to understand where we are and where we need to go, and we can't let up. There are lives to save, a lofty vision. I'm glad to have been part of it, but I'm really grateful that all of the people that we have heard from today, especially the field, is engaged. And I'm hopeful that one day we will no longer see malaria the burden that it is today. Again, Dyann, back to you and thank you.
Thank you very much. Thanks to both of you for those very inspiring comments. And let me just say happy birthday to the President's Malaria Initiative. I think looking to the past, there have been great accomplishments, and I think that gives us hope for the future. The other thing that I think gives me hope for the future is that we have trained a new generation of people focused on solving major public health problems, and they're really the future of being able to achieve our goals. And so with that, again, PMI has played an important role at the country level in bringing expertise and in helping country national malaria control programs really increase their capacity. So again, happy birthday and congratulations. And Karen, any final words? You're maybe not on. So
Yep.
I guess,
Yeah.
okay.
I'll just say that it's really, in these really tough times when we're dealing with a lot of anxiety, to be reminded of incredible success stories that seemed impossible in the beginning. It didn't stop anybody, and it doesn't stop anybody now. So it's a great way to start off the day, because we need these kinds of reminders of success, and that the success comes with everyone's participation. Thank you.
All right, well, thanks everybody for joining us. And I think with that, we'll give everyone a couple of extra minutes to get to the next event at ASTMH. So congratulations and happy birthday.